Rainier Avenue Radio.
Rainier Avenue Radio presents an opportunity for you to learn more about generational wealth. December 17th from 4 to 6 p.m. at the Columbia City Theater. What is generational wealth? People tend to think of generational wealth as old money, but the potential to leave a financial legacy exists for anyone who generates more income than they spend. If you want financial independence for yourself, your children, your grandchildren, you need to start thinking strategically. December 17th, between 4 to 6 p.m., join us at the Columbia City Theater, kicking off a campaign to raising awareness to creating generational wealth. Generational wealth is family wealth passed down from one generation to the next, repeatedly. Want to learn more? Join us at the Columbia City Theater, December 17th, 4 to 6 p.m. to learn more about planting the seeds of generational wealth, what it means, and building your family dynasty. December 17th, 4 to 6 p.m. at the Columbia City Theater. Sponsored in part by the City of Seattle Department of Neighborhoods and Rainier Avenue Radio .world. Build your generational wealth.
You're listening to Rainier Avenue Radio .world. I'm Granville Emerson along with my partner,
Ronald Pepe Bean.
And we host the show Little Line Sports right here on Rainier Avenue Radio .world, where we talk about football, basketball,
Local sports,
national sports, Seahawks,
UW,
Seattle U Redhawks,
Garfield Bulldogs.
all that and more right here on Little Line Sports on Rainier Avenue Radio .world.
This is Mondo Baccaro for Mondo's World. We will be discussing some interesting subjects. Sometimes I might even have some guests. So please listen to my show on Rainier Avenue Radio.
If you or a family member are 55 or over and need nursing home level care, but want to keep living where you are, check out Providence Elder Place PACE. This program offers healthcare, housing, transportation, and recreational activities. There are no co-pays or deductibles, and it's covered through Medicare and Medicaid. Providence Elder Place PACE works to keep healthy and in your home. Call 206-320-5325 or visit providence.org Elder Place. Providence.org Elder Place.
This is Paul Pearson, host of Star Time. And when I'm not shouting "Badia" at city council meetings, I'm listening to Rainier Avenue Radio .world.
This week. Okay. Having a little trouble hearing. There we go. There we go. Welcome to this week's edition of the impacts of the coronavirus on South Seattle and surrounding communities. It's me, Tony B, and we are in our third pandemic winter. We'll see if it's still a pandemic winter. Well, we're going to be talking with Dr. Mark Del Baccaro. This winter, I think everyone feels a little more safe, a little more comfortable. We do have vaccines. Boy, we've had a lot of conversations about this pandemic. And as we enter the winter months, there are a couple of other things that come up. The flu. There's this thing called RSV. The COVID is still here. And we're going to talk about all this as, again, now that we are in this third pandemic winter, and maybe I'm wrong. Maybe it's different, but I'm going to welcome to the program. I told you he'd be back. Dr. Mark Del Baccaro. Mark, how are you, Dr. Mark?
Great. How are you, Tony? Can you hear me okay?
I can hear you okay. I'm a little concerned that you're driving.
No, I'm the passenger. I am not the driver.
Okay. Okay. All right.
Make it a
Well,
little better.
that's good to hear because I don't want to promote people driving and trying to do this at the same time, especially when we're talking about or anybody's talking about critical issues that are important. You got to focus on driving. We don't want that. So for those of you who are watching, no, Dr. Mark is not driving. He is a passenger. Well, first of all, good to have you back. How are you doing?
Great. Thanks for having me back. And it's always fun to be on your program and also to listen to what you're doing to help the community.
Now, I said that we were in our third pandemic winter. Clearly, we remember the first pandemic winter.
Right.
We remember the second pandemic winter. This one's a little different because we've had vaccines now. Folks are vaccinated. We know a little bit more. You can also get treated. Is that a fair statement, or was I wrong when I say we're in the third pandemic winter? Because some might say, "Oh, you're Chicken Little. You're stirring things up," when that's not the case. Is that a fair statement?
I think it is. It started towards the tail end of the winter 3 years ago, so not at this time so much. It was in retrospect, we realized it was in the world and probably in the country right about this time. But the full-blown part of the pandemic, where it affected a lot of people, came a little later in the first winter. But you're right; it's the third winter.
Yeah. So we had 2020, which
Right.
the winter of 2020. Then we had the winter of 2021. Again, that first one I'm not necessarily counting because we didn't know what we were facing. But now the winter of 2022, where are we at in that regard, just to set the tone for this conversation, in being prepared to deal with the coronavirus? Got some other things we want to talk about too. Again, the flu and this thing called RSV. But where are we at in regard to what I'm calling the third pandemic winter?
Well, you're right. We are in a little bit better shape, not as good as where we want to be. We certainly have a lot more people immunized than could have been immunized in the first winter or the second, because the vaccines had just started to roll out. If you remember a year ago, last January, coming up, that's when the first Omicron variants came, and we had a huge crush of cases, unprecedented number. And that's about the same time that the vaccines started to come out. So when we are entering this time, King County is much more highly vaccinated than most counties in the country. That is definitely true. However, we do have a high percentage of the population that haven't had their booster yet still. And all the vaccines, you start to wane a little bit in your immunity over time. So unfortunately, we still have a huge number of people in King County, especially the most at risk, like elderly folks, who still have not received the new updated booster against Omicron. So in some ways we're better off, but we're nowhere near where we need to be.
Well, let's have a little review here. So when you say at risk, what populations are we talking about when we say for folks? Because it may have been a minute, and folks may, hey, am I part of this category? Who are the folks that we are highly recommending that you get a vaccine that we're calling potentially more susceptible? I would say.
Well, it depends how you want to define risk. In the ultimate worst kind of scenario, risk of death is obviously the worst, right?
Yeah.
And that's age dependent. So the older you get, the more at risk you are. And if you have any other chronic illnesses like heart disease or diabetes or other things. But clearly the group most at risk to die are people that are older, especially as you get 65 and older. And in that group, only half the people in King County have received their booster for the new Omicron. And even, unfortunately, less so in the Black African American and some other communities of color. There's probably pretty good evidence that age 65 and older, while they're the most at risk for death in general, or the most at risk for serious hospitalization, for communities of color, that age is actually younger for being at risk. So really, it's, it depends also if your risk is about getting Omicron and getting sick and potentially getting long COVID, that's all age groups.
Yeah. Do we know what that age is that you're talking about for communities of color when you say it's lower? Do we?
There's some data around that anyone over age 50 or 55 in communities of color due to poor access to healthcare and more chronic health conditions are also in the kind of equal to somebody who's 65.
Wow. Again, you're listening to the impacts of the coronavirus on South Seattle and surrounding communities. It's me, Tony B. My guest is again Dr. Mark. And since we were bringing up vaccines and you brought up Omicron, let's review this too, because when you talk about getting booster shots, there's this $30,000 word called bivariant or something like that. Can you
Right.
explain
Sure.
what we're talking about and the difference between the boosters and what this bivariant vaccine is?
Sure. If you remember, the big surge in infections we had last January were caused by new Omicron strains, and there were two of them. And what they were changes to two of the proteins on the viruses, two of what we call spike proteins. And so these two, the new updated boosters, have slight changes to target those new spike proteins, the two of them, and that's why the term bivariant, bi for two. And they still target the original ones. So these new updated vaccines are targeting both the original strains and these two new Omicron strains that became very prevalent over this last year.
Okay. Now, folks are familiar with COVID, again, because of, the past couple of winters, past couple of years, but in particular winters. So the flu is something that's been around for a long time. What's going on with the flu this year?
Well, there's a couple of things. One is because we were really good over the last 2 years in general about social distancing and wearing masks and being careful being around people, that a lot of people didn't get flu in the winter of 20 and 21. And in fact, because of that, the number of flu cases were at a relatively low point when you compare it to any of the last 10 years or so. But now that we're all out in the open, very few people are wearing masks. I wear masks when I'm indoors, but not very many people do. I look kind of different wearing a mask. It's much easier to spread. And as you may remember, I used to be an emergency room physician, and
Yes.
we always knew that comes fall and winter, when, especially in our climate, where people go back indoors and they close their windows, and everybody's close together and breathing the same air, all the regular winter viruses like flu and RSV and a bunch of other ones, even the common cold, become much more common. This year, unfortunately, because partially we don't have natural immunity and people weren't getting the flu shot as much the last 2 years as maybe some other years, we're more susceptible to flu than we were, say, 4 years ago, when people were getting the vaccine at a higher rate.
Now, is that something that, again, it's just because we were wearing masks, we were protected, or is this something like COVID, that this is another, I'm just going to call it, variant of the flu, or can you explain that to me, Dr. Mark?
It's a good question, Tony. It's a little bit of both, because every year the flu virus changes a little bit, just like the Omicron virus is now. And every year the flu vaccine is changed a little bit to accommodate that. So that's sort of normal changes to the flu vaccine, and that's been happening for many years. Omicron for the COVID is doing kind of the same thing. And in essence, we really want people to start thinking about every fall they're going to need a new flu shot and a new COVID shot, because the virus changes a little bit. Plus, over a 6 to 12 month period, your immunity from that shot starts to wane a little. It's not lifelong immunity. So what we want people to start to do is think about every fall, I need to get a flu shot and I need to get a new COVID booster because the viruses change a little and your immunity wanes. I think the other thing that is making this year harder for both flu and RSV and others is because of the social distancing and whatnot. We also didn't have very much natural immunity because people weren't seeing the virus because we weren't, congregating like we would in a normal time period. So it's a combination of both those things.
Oh boy, you brought up something now that I'm going to have to address. For people who say, well, we should have never taken those vaccines in the first place so we could build up natural immunity. And now I just heard you say something about the fact that we're lacking that natural immunity. Just explain that so that it makes sense. So that
Sure.
if we're having a conversation and folks are saying, well, that's why I'm not going to take the vaccine because I lose my natural immunity.
Well, the people that are saying that are also not really remembering that people that don't get vaccinated die at a much, much higher rate, and they get hospitalized at a much, much higher rate, and they end up sick at home or in an ER at a much, much higher rate. So if you relied purely on natural immunity, flu in a normal year kills anywhere from 20 to 60,000 Americans a year. Some years much higher than that.
Mm-hmm.
And the overwhelming majority of them are not vaccinated. What does happen is people get flu, even sometimes if they're vaccinated, but their illness is much less severe when they're vaccinated. And that's true for COVID also. So if you get the COVID booster or you last year got the COVID shot and you got COVID, your illness was much milder and you built up a combination of both vaccine and natural immunity. And so it's that double combination that makes it more difficult for you to get seriously ill. So people that rely on pure natural immunity are playing basically Russian roulette. Whereas people who are vaccinated who might get an infection are much more likely to have a mild illness and not end up in the hospital or not end up with long COVID and not end up dying.
All right, Dr. Mark, we're going to get into some other subjects, but before we do, this thing called RSV, what is it? How long has it been around? We weren't talking about RSV during these last pandemic winters. At least I wasn't, and I wasn't getting information from King County about something called RSV. Now,
Right.
we are talking about something called RSV. Is it a flu? Is it a COVID? Is it a respiratory illness? What is it?
It's a different respiratory virus that comes every winter. It most severely affects young kids and especially infants. So as a ex-pediatric ER doc, I was used to seeing it every winter same as my colleagues all across the country and the world. What made it different this year is it came a little earlier in the season in terms of its intensity. Normally it peaks more in the middle of the winter. And the unfortunate part this time is that it's coming at the same time as the flu and our existing COVID infections. So that's why you hear people call it the triple-demic. RSV, unfortunately, does not have a vaccine that's available right now. There's vaccines that are in testing, but there aren't any right now. So when a person gets it, if they're healthy and an adult, they usually only get like a cold. Nothing really severe. If they're a young child, especially under 2 and even more so under 1, and if they're premature or have any other health conditions, it can be extremely dangerous and even deadly to young children. And some older adults whose immunity is waned and they have other chronic health conditions can also get sick with it. But it's really mostly concentrated on the very young.
Okay, so how do you know if you have what I'll call a common cold? Maybe you have contracted COVID. Maybe you might have the flu. But this RSV, does it, how do you know, how do you determine, whoa, I might have this thing called RSV when it, or is it very similar to the things that I just mentioned, the flu, cold, and COVID? You know what I'm getting at, Dr. Mark. Now we've got you call it a triple demic.
Yeah.
And this
Yeah.
is something that is potentially even more dangerous to children, because for a while folks were saying, well, children are, their immunity to COVID is pretty good. I don't know if that's still the case. But with RSV, you're saying that two and under one, when they really can't communicate. Um, eh, how do
Right.
folks determine, well,
Yeah.
you know what, if
It's
this
it's
is
a tough.
cold? Go ahead.
It's tough. It's tough. That's a great question. There are some subtle differences, but they're not different enough that you can just tell often on your own. I think that part of the difference is it's. I will just say right off the bat, it's really tough. There's not an ironclad way of telling the difference. One way of telling the difference certainly is if you are really, really sick, you should get tested, and testing can give a definitive answer. If you have a mild cold, and a mild sore throat, and a mild cough, it would be pretty hard to know which it is. In past years, when we didn't have COVID and it was flu season, we could tell people, well, the flu is so high right now, just by where we are in the flu cycle. We could tell you that you probably have the flu, but now it's hard because COVID, flu, and a lot of other things have incredibly overlapping symptoms. And so you can't just say, oh, I just have a mild cough and a mild cold and I only have the common cold. You could, especially if you're partially immunized, have a mild COVID infection. If you're, you could have almost anything. So part of what we would say is if your symptoms are worsening, we would ask you to figure out how to get testing. You can get COVID home testing. Both the state and now the federal government again has made it possible to get it mailed to your house. You can pick them up in pharmacies often. If you need to, there are still COVID testing sites open around the county, including one in Rainier Beach. So if you're not sure, you should get it. And if you have an underlying health condition or you live with somebody that does, I would say that you should err on the side of either getting a home test or getting a PCR test because you just don't know.
Well, Dr. Mark, it is ironic that we now have all this information about COVID that we didn't have a couple years ago. But I'm going to go back to RSV. Is there a test for RSV? Again, and I'm asking this on behalf of parents of young children,
Yeah.
because you say this could potentially be very severe. Is there a test for RSV that you can administer?
There is. We only usually use it if somebody is significantly ill, because if they just have a mild cold and they're doing fine, there's no medicine to treat it. Unfortunately, even when they're fairly sick, there's not a medicine per se. You just treat the symptoms. So usually you're not tested unless, for kids, most of the time, unless they need to be hospitalized, or there's some other reason to test them. So for older children and adults who aren't significantly ill and have only mild symptoms, they wouldn't get tested for that. You might get tested for the flu and you might get tested for COVID. And if those two are both negative, you might have RSV, but you could also have any one of several winter viruses, none of which have treatments.
Okay, I'm going to stick with this RSV thing here for a minute, because we just haven't talked about that a lot, Dr. Mark. Is it the same as COVID and the flu in your ability, if you're, I'm going to use the word, if you have it, if you're infected, can you give it to someone else? Can a child give it to an adult? Can an adult give it to a child? Is it transferred in the same way? Are there differences in the way that
Yeah,
this
it is.
lives?
No, it's transferred. It is a respiratory virus, so it's transferred in respiratory secretions, coughing and sneezing, and then touching surfaces that have been coughed and sneezed on, or those kind of ways. So it's spread the exact same way as other respiratory viruses. It's just that it doesn't cause usually significant illness unless you're a young infant. So most people in the home, like an older, early school age child could get it and have just a cold, but if they have like a 6-month-old, sibling, they could end up giving the sibling RSV, who could get much sicker instead of having just a cold.
Okay, so it is transferable, and I'm just repeating what you just said. So you may think that you have a common cold, you're in high school or whatever, and you're a young adult, and you're around under 2, under 1. It may not be a common cold, even though that's how you feel. And if it's RSV, you can still give that to an infant. That's correct.
And we should think of infants and older adults as kind of the same at the two ends of the age spectrum. Any virus can make either one of them significantly ill. So a healthy, 10-year-old can get the flu and maybe feel bad for a day or two, or a young adult. And not that they can't get super sick, but they're not as likely to. But if they give it to somebody in their home that's older or an infant, they can have very significant illnesses. And that's true whether it's COVID, RSV, or the flu. And so because you don't know what you have to be trying to do everything you can to minimize spreading it to others. So for instance, if you have a cold, you should really think seriously about, do I go to the family holiday party? If I'm going to the family holiday party, test yourself for COVID for sure. If you can try to get tested for flu also. That's not as easy, but you can get tested. And then the other is really think about, should you be going? You need to wear a mask. They need to open windows and ventilate the space. And people really need to get vaccinated so that they don't have the risk of carrying those particular viruses.
And that is part of the reason we're having this conversation, because there are a lot of family gatherings during this time of the year. And so what about the hospitals? Are hospitals under stress because of this tridemic? Is it?
Absolutely.
We heard about it because of
absolutely.
COVID. Go ahead and talk about this. We don't hear about that as much. Maybe internally you do, but for a while it was all over mainstream media. What's going on with the tridemic and our hospitals, our hospital workers, hospital staff? Yeah,
Great question, Tony. And I would say it's definitely happening. You're right. It's not necessarily quite as well publicized, although it is. I did see a lot of things in the media, national press over the last couple of weeks. And it kind of depends a little bit about what kind of hospitals. So like the pediatric hospitals, both locally, Seattle Children's, and nationally, are reporting that their ERs and their inpatient wards are really stressed to the max, with people either sick enough to be admitted or sick enough to be seen for it. So long lines in the ERs and a lot of difficulty, with the number of beds that are open in pediatric hospitals and ICUs because of this. And then in adult facilities, they're not really getting as many, obviously, people admitted with RSV, although some older adults, but it's mostly flu and COVID at this time. And as you pointed out, the staff themselves are not immune from, they can get sick too, because either they haven't got their booster or they just get sick. And staffing in hospitals has never really recovered to pre-COVID levels. All the hospitals are under extreme stress with being not at the staffing that they would want to be or need to be to deal with the pandemic, and let alone regular care. If you remember last year when things were really bad, people presenting for non-COVID related illnesses like heart attacks and appendicitis and serious infections had to wait long times in emergency departments, or once they got diagnosed, they sometimes had to get flown to a different hospital because there were no beds. And while we're not quite at that level, the systems are definitely strained, and they're getting filled with people with flu, and to some extent with COVID, especially elderly patients.
Okay. What should folks do if you are feeling sick? What is the course of action that folks should take? Again, at this point, we'll just say could be flu, could be COVID, could be RSV. What should folks do? Could be a common cold.
Yeah, at this point, the best thing to do would be to do a COVID test for sure, because that you can do on your own, or like I said, go to a drive-through, right? The second is if your symptoms are getting worse, if you're having trouble breathing and other things, you definitely need to get evaluated somewhere. And then third
You're
is
saying go to an emergency, go to a hospital, go to.
well, if you're having trouble breathing, you should always get seen right away. If you're just feeling bad, then talk to your regular provider. You don't necessarily need to be seen for that. And they can talk with you about, following you. But if you're having trouble breathing, or if you have underlying chronic diseases and, your energy level is horrible, you should immediately call your doc and probably go in and get evaluated. But if you're just feeling sick, you don't need to go in and get seen. You should get tested, though, to see if you have COVID. And then the other big thing is, you need to take yourself out of circulation, especially at family events, because as much as we want to get together, family events are packed in, usually in somebody's house, small rooms, and there's usually at least somebody in there that's either an elderly person or an infant or somebody with a chronic disease. And if you give them the flu or COVID, they may end up not making it. And that's not what you want to have weigh on you.
Dr. Mark, again, we're almost out of time. You know what that means. At some point, you'll have to come back again. But I do want to give you about 30 seconds here for final words. If there's something we missed or something that you just like to share with our audiences.
Well, I think we covered it pretty much. I think the biggest thing is, as we said, unfortunately, we only have about half of our, we only have about 25 to 30% of the King County residents who can get a booster have gotten a booster. So we still want people to get a booster. And even in older folks, the number of people that have received the booster is only about 50% overall, and it's less in communities of color. And so one thing is absolutely get your flu vaccine and get the COVID vaccine. That'll help you, if you do get it, to be less sick. It'll protect you from getting long COVID, and definitely protects you from serious illness and death. So one is to get vaccinated. And two is, even if you're not sick and you're going to family gatherings, consider testing yourself before you go, and see if you can arrange the room so that there's windows open and air circulating to cut down on the amount of virus that's concentrated in the air.
Dr. Mark, thank you for joining me. I'm a little over time, but well worth it. Always appreciate you being here.
Can I have one more 10-second? One is I want to thank you, Tony, for having me and all the amazing work you do for your community. And to let you know, I'm actually retiring from public health at the end of the month, and I have thoroughly enjoyed being able to be on your show. You're an amazing host and an amazing beacon for the community. So thanks for all you do.
Oh, thank you so much. And congratulations to you. Well, I don't know. Maybe we'll have to get you back on and just so you can say goodbye or something, Dr. Mark.
Okay. Take care, Tony.
That's all the time I have. That's going to do it for the kid. It's me, Tony B, saying, remember, whether you believe you can or whether you believe you cannot, you are probably right. I'm out. Peace.